Welcome to The Birth Breakdown, a minisode series from Her Birth, Her Story. These short episodes are here to open conversations around pregnancy, birth, and postpartum. Things I believe that every woman deserves to look into, to question, and just to feel empowered by. This isn't about telling you what to do, what's right, or what's wrong. It's about giving you space to think, to learn, and to ask questions, to just trust yourself a little bit more as you prepare for your birth. So let's break it down. On this episode of The Birth Breakdown, we're going to be jumping into that very first appointment. And I know I've already said multiple times too, a lot of times this happens between 8 weeks and 12 weeks. They normally don't want to see you until this time anyway, but sometimes we can get impatient and you just want to double check, like you've taken the pregnancy test, you're pregnant, and you just don't believe it. So you want to test and see. So we're going to jump into some of that and just some things that you should expect before you're pregnant, confirming that you're pregnant, and then things at your first appointment that you should be expecting. And we will go into medical side and holistic side as well. So before your first appointment, a lot of times we are always asking, when should I call and schedule? Well, obviously, it just depends, especially if this is your first, you probably want to call like right away. Like you just found out and you're like, oh, I'm gonna call. Well, a lot of times they're not going to see you until 8 to 10 weeks, sometimes even 12 weeks pregnant. And the reason why they do that is because at that point in time, from 8 to 12 weeks, we'll just give it that big gap of time, they're more likely to be able to see a heartbeat and accurately date the pregnancy. And a lot of times people think earlier is better, but that's not always the case, because if you ovulated earlier than you expected, it may simply be too soon to see the things that they all like to see, which then can create unnecessary anxiety later on. So just waiting for that 8 to 12 week time is really important. So a lot of times too, with your first, you take that pregnancy test via urine. It confirms your pregnancy because of HCG that is in your urine. But many people just assume that the doctor confirms pregnancy with another urine test, but that's not always the case. If you do go to the doctor just to confirm pregnancy, they often will look at your positive pregnancy test or even do a urine pregnancy test themselves. And normally they'll order blood work, especially if you do have a history of miscarriage or if there's bleeding or just uncertainty. And the blood HCG measures the amount of pregnancy hormone, but it isn't routinely needed for like uncomplicated pregnancies. So if you do go and you do request the blood test to confirm, and a lot of times they'll do multiple blood tests in your first trimester if you do have a history of miscarriages to double check that your HCG is hitting the right numbers when it should be. The next part, which is the main part that I want to talk about, because a lot of times people don't understand why they can't go get an ultrasound right away and why they have to wait between the 8 and 12 week mark. And that's because there are multiple different kinds of ultrasounds that you can get. The first one is a transvaginal ultrasound. I have never had this done because, to be honest, it just seems very uncomfortable and unnecessary for me. And personally, I just did not want to really mess with this. But if you are obviously having more of a risky pregnancy, do have a history of miscarriage or things like that, they might want to do this. But basically what this is a thin ultrasound probe that is inserted into your vagina, and it gives a much closer view in your early pregnancy. And this is actually the preferred method if you are before 10 weeks, just because the uterus is still pretty low and deep into your pelvis. And I actually got an early ultrasound in my most recent pregnancy just because I was confirming that there was one baby in there, and I wanted to kind of see where I was tracking because I had like 4 different due dates. And we'll get into due dates at another episode, but luckily for me, we could still see everything with a ultrasound on top just because I did not want to do the transvaginal, so it was fine. But that is why the transvaginal ultrasound is recommended, because it is a lot clearer before 10 weeks. So if you are not wanting to have the transvaginal ultrasound, do not schedule anything before 10 weeks. And also, this is generally considered safe in pregnancy and does not increase the risk of miscarriage. Obviously, look into that to double check that fact as well. But things that they normally look for in the transvaginal one, because remember, you are getting this done before 10 weeks, they're looking at the gestational sac, the yolk sac, fetal pole, heartbeat once it's visible, number of babies, your dating measurements, and then the location of the pregnancy to really help rule out any ectopic pregnancy, especially if you have a history of that. The other thing that I will say that is actually really cool if you do have an early ultrasound done is they can actually tell you which ovary was the one that ovulated, that you conceived with. So I thought that was really cool. And sometimes if you wait until 10 to 12 weeks, you actually won't get to know that. Sometimes in the earlier, before 12, they still can, but that is one of the cool things that are neat with an early ultrasound. Next is the abdominal ultrasound. So this is like the typical gel on the belly. And one thing that I have learned personally for myself is sometimes a full bladder helps. But for me, in my case, a full bladder, especially in early pregnancy, a full bladder actually made it worse. It basically covered up the baby so that they couldn't see. So sometimes you'll need a full bladder, sometimes you won't. And usually the abdominal ultrasound becomes a lot easier as your uterus grows because of the images that it gets. It's more clear. That's why they do that at your 20-week ultrasound as well. Some practices do use abdominal ultrasounds, like I said, around 8 to 10 weeks. If they have high quality equipment, and if they don't, they will want to use the transvaginal ultrasound because it will be more clear and they can get more accurate data. So basically in this first trimester, some other things that happen, especially at your first doctor's appointment, they're going to be reviewing your health history. And I mean all of your health history. So if you've had any previous pregnancies, medical conditions that are important that they need to know, any other surgeries, medications, allergies, family history, and they will ask you your lifestyle factors like smoking, drinking, drugs, because that will really contribute to the education that they give you based on your lifestyle. Next, which we talked about before in a previous episode, but lab work. Normally at your first appointment, they will do lab work because they want a baseline to make sure that as you go into your second and third trimester, you are continuing to hit the growth that is needed so that there are less complications when you give birth. So a lot of times they will also do your blood type and RH factor, which is very important, which I might do an episode on this as well, but this is where that RhoGAM shot comes into play. And they want to make sure that if you're positive and your baby's negative, they just want to make sure that that can cause them to basically, essentially like attack each other. There are just some things that you really have to take into account when it comes to that. They're going to do a CBC, which is just your traditional blood panel. If you have immunity to rubella, STD panel, urine testing for infection and protein in your urine, and then screening for any STIs if it is indicated to do so. And once again, these things just really help get an overview of your baseline of health as you move forward into your trimesters, because this is not the only time that you will get blood work done. And if there's anything that you want added onto that, please always feel free to ask your provider. It may cost more. Sometimes insurance doesn't cover things that are additional, but if it is something that you feel is going to be beneficial to helping your pregnancy be better, please add that on, especially if it's something peace of mind. Just ask them to add that on. Also, during this time, they will ask you if you want to do genetic screening. Just remember, this is something that is optional, and a lot of times it could pick up things that actually don't end up being an issue and vice versa, to where things are not picked up until the 20-week ultrasound. So this is not a thing to where it is always accurate, just like with anything, just because every single thing is not accurate. Things on your 20-week ultrasound can still be missed as well. Same with any kind of screening. So just take that with a grain of salt as well. And just like I always say all the time, please look at the risks and the benefits that come with each thing. And you have to decide for your family, not just what they say is normal, not just what Susie did down the street. Look into it. If it's something that you feel comfortable doing and you want to do it. And if it's something that you're like, I think it's unnecessary, great. That's awesome. You should feel empowered either way, no matter what. So basically what your provider is going to do is they're just going to discuss this optional, and I'm highlighting optional, screening tests like the NIPT, a carrier screening, and even a NT ultrasound. Typically, that ultrasound is done a little later if you choose to do it, but just remember, optional. And it's meant to provide information and not diagnose every condition. Okay, so if you feel like it's great for you, do it. And if you don't, it's optional. So you're good. Some questions that you should definitely ask. What symptoms should make me call you? We did an episode on some common symptoms versus some red flag symptoms too previously, so definitely give a listen to that, but also ask your provider this. Also, who do I contact after hours? What medications are okay? The medications I'm currently taking, are those still okay, or should I stop taking them? What exercise restrictions do you recommend? Now, the only thing with this question that I will caution you on is you have to just be careful with your provider. If you are somebody who has already been working out, stopping and only walking, I do not feel is smart, but trust your intuition a little bit. And I hope that your provider is going to encourage you to continue to work out, especially if you are at low risk, because it really is so valuable for you and your baby and your birthing experience. Can I travel? What prenatal vitamin do you recommend? Now, the only other thing I will say with that question, we also did an episode on a good quality prenatal. Depending on your provider, and this is more from a hospital standpoint, they're going to tell you a lot of times just the big name that you can get at any store. I just caution you with that, because just because it's a prenatal does not mean that it's actually good for you and you are getting things from it. So please listen to the episode that we did and just make sure that it is quality and has actual things in it. Folate, not folic acid, especially for my moms who have that MTHFR gene. Do yourself a favor so that you can actually absorb it. Anyway, and then when is my next appointment and what can I expect in my next appointment? And so from a holistic view, one thing I just always encourage moms to remember is that at your first appointment, it's not just about your provider getting to know you. It's also your opportunity to get to know them. Ask questions, as many as you want. Pay attention. How do they communicate with you? Do they look you in the eye? Do they act like they actually want to serve you? Do you feel heard? Do they explain their recommendations, or do they just tell you this is what you need to do? Pregnancy is a long journey, and you deserve a provider who partners with you in your care, not just tells you and is like a dictator to you and tells you what you should be doing, because that is not helpful. That is why, too, and even in the hospital setting, a lot of people are starting to swing more to midwives, because even in the hospital setting, yes, they're still a little bit more medical minded versus like a home birth midwife, but they just seem like they care a little bit more. And it's not just about get them in, get them out, get them in, get them out. If they're pressuring you and they only give you 15 minutes and then they're not done, finished answering all your questions, find somewhere else to go. Because if they treat you like that in a prenatal appointment, guess what will happen with your birth? The cascade of interventions, because they're looking at you as a number. They're not looking at you as someone that they get to serve, and they get the privilege of walking through this journey of motherhood with you and then watching you become a full-blown mother when you birth your child. And it's just not worth it at all. So at your first appointment, use your first appointment as a time to, get your baseline health stuff down. So that might include ultrasound, definitely blood work. You also can skip the early ultrasounds. You do not have to get an ultrasound between weeks 8 and 12. You can literally wait until your 20-week appointment. I ended up actually doing the early one just because as a first-time mom, I was really freaked out, but I only did that one in the 20-week ultrasound. My second one, I only did the 20-week ultrasound, but then I had to get more ultrasounds later on because I was late and he was breech. And then this third one, I ended up getting an early ultrasound because I was worried that there was more than one. So that was literally the only reason why. But you don't have to. You don't have to get an ultrasound. And you're also allowed to tell them, like, I do want an ultrasound, but I want it to be quick, because really the whole reason why people try to limit the ultrasounds that they get, yes, it's really cool to see your baby, but the reason why people limit the ultrasounds that they get is because the radiation exposure that happens, because with that, what's happening is the heating up with that gel right there, the heating up of your tissues in the inside. And depending on how you think, what research you look at, obviously do your own research, but it can, if you have too many, or even those 4D ultrasounds, be careful with those. Just look into benefits and risk and outweigh them and what you feel comfortable with. But just know you don't have to get the first trimester ultrasound. You can wait until your 20-week anatomy scan, and you don't have to get another one the rest of the pregnancy unless it's recommended by your provider. Use this first meeting as a way to vet your provider, because once again, just remember that you are able to hire and fire as you please. You are allowed to be like, wow, I did not like how I was treated, and then I'm going to find somebody else, and that's totally fine. And so use this as time to get to know them a little bit more, ask them the questions. Leading up to this point, really start looking into how you think you would want to birth and ask them questions like, how do you deal with unmedicated moms when they come in here? What's your viewpoint on physiological birth? And what's your C-section rate? What is the percentage of induction that happens? These are all important questions to really ask, and write them down. Ask the questions while you're there, and don't let them just push you out in 15 minutes. Like, you are not on a conveyor belt. You are a human being who is on a journey right now. That's one of the most important journeys in your life. It's a long time, and you deserve to be heard. You deserve to be seen. So make sure that you have a provider who does that. So I hope that this episode was really helpful in hopefully giving you just a little bit of an idea of what that first appointment in your first trimester could look like.
If this episode sparked curiosity, affirmed something you've been feeling, or just gave you a whole new perspective, I'd love for you to share it with another mom or mom-to-be who might need it. Make sure you're following Her Birth, Her Story, and if you feel called, leaving a review is one of the best ways to support this space. And it just helps these conversations to reach more women. Until next time, remember, this is your body, your baby, and your birth. We are reclaiming birth, one story at a time. I also want to add this disclaimer that this is not to be taken as medical advice. Please make sure that if you are seeking medical advice, then reach out to your own provider so that you can figure out what is best for you.